Good day everyone, I am Frederick Jasper Baldos from Visayas State University.
Good day everyone, I am Ambid from Visayas State University.
Today, I am going to portray Ranolazine. So, I am a prescription medicine used to treat the symptoms of chest pain, may be used alone or with other medications. And then my brand name is Ranexa. My chemical name is... For my drug classification, therapeutic is anti-anginal and pharmacology is fatty acid oxidation. Anti-anginal drugs are used to provide immediate relief from symptoms and prevent angina attacks, while fatty acid oxidation is the mitochondrial aerobic process of breaking down a fatty acid into acetyl coenzyme A units. This is my chemical effect. May result from increased efficiency of myocardial oxygen used when myocardial metabolism is shifted away from fatty acid oxidation toward glucose oxidation. Anti-anginal and anti-ischemia properties don't decrease heart rate or blood pressure and don't increase myocardial work. For its therapeutic effect, relieves chronic angina.
Hi, I am still Ranolazine and I will continue to discuss my autobiography. My twin already discussed our drug name, drug classifications, pregnancy category, and mechanism of action. And now I am going to discuss our pharmacokinetics, indications, contraindications, and side and adverse effects. And now I am going to discuss my pharmacokinetics. Under pharmacokinetics are my absorption, distribution, metabolism, and excretion. My absorption is highly variable, which means that my within subject variability equals or exceeds 30% of the maximum concentration and/or the area under the concentration versus time curve. Also, my steady state occur within 3 days. I am distributed 62% bound by plasma protein. I am rapidly and extensively metabolized in the liver and intestine, mainly by the CYP3A and CYP2D6 to form metabolites. I am excreted 75% in urine and 25% in feces. Also, my half-life is 7 hours. And now I am going to discuss my indications. I am indicated in patients with chronic angina and those who are given amlodipine, beta blockers, and nitrates, and also in patients who haven't received adequate response with other anti-anginals. So I am already done discussing my indications. And now moving forward, if I have some indications, I also have contraindications. So for now, I am going to discuss my contraindications. First, I am contraindicated in patients taking QT interval prolonging drugs or CYP3A inhibitors, including diltiazem. Also, I am contraindicated in patients with ventricular tachycardia, hepatic impairment, or prolonged QT interval. And as a reminder, I am used cautiously in patients with renal impairment. And now we're done talking about my contraindications, and the last information that you will know about me is the side and adverse effects that I cause to the different body system. Starting with the central nervous system, I cause headache and dizziness. In the cardiovascular system, palpitations, peripheral edema, and syncope. In the eye, ear, nose, and throat, I give tinnitus and vertigo. In the gastrointestinal, I cause abdominal pain, constipation, dry mouth, nausea, and vomiting. And the last one is the respiratory system, in which I cause dyspnea. So, I'm done discussing my autobiography, and now we're going to move to the nursing responsibilities. assessment should be done by the nurse in order to obtain data to come up with a nursing diagnosis. Afterwards, do some planning and implementation of the intervention. And next is to evaluate the patient.
Assessment. Obtain history of patient's underlying condition before therapy and reassess regularly thereafter. Monitor ECG for prolonged OT interval and measure the OTC interval regularly. If patient has renal insufficiency, monitor blood pressure closely. Nursing diagnosis. Ineffective health maintenance related to underlying condition. Decreased cardiac output related to drug-induced adverse reactions. Deficient knowledge related to drug therapy. Planning and implementation. Drug may be taken without regard to meals. Don't crush or cut tablets. Patient teaching. Educate patient about drugs' potential to cause an irregular heartbeat. Advise patient to immediately report palpitations or fainting, and to tell prescriber about all other prescription or OTC drugs or herbal supplements he takes. Tell patient that he should keep taking other drugs prescribed for angina. Explain that drug won't stop a sudden angina attack. Advise him to keep other treatments such as SL-nitroglycerin readily available. Tell patient that drug may be taken with or without food. Advise patient to avoid grapefruit juice while taking this drug. Warn patient that drug must be swallowed whole and not crushed, broken, or chewed. Tell patient to avoid activities that require mental alertness until effects of the drug are known. Evaluation. Patient shows improvements underlying condition. Patient maintains adequate cardiac output throughout therapy. Patient and family state understanding of drug therapy.